serves as chair of several committees, such as the newly formed Workforce Education and Equity Committee, the Mayor's Complete Count Committee for the 2020 Census, the Housing and Homeless Solutions Committee, and serves on the Public Safety Committee. Mr. Thomas was also recently appointed as Vice Chair of the Racial Equity and Leadership, or REAL Council, for the National League of Cities. We next have Dr. Emmanuel George III, who serves as the Associate Dean of Students and Alumni Affairs and is an Associate Professor in the HSC College of Pharmacy at University of North Texas Health Science Center in Fort Worth, Texas. A native New Orleans, Louisiana, Dr. George has experience and expertise in operationalizing healthcare events, including mass immunization clinics, health and wellness events, and interprofessional education and training. Next, our moderators, as mentioned, we have Dr. David Osula, who grew up in Alabama and is currently a second-year internal medicine resident at UT Southwest Medical Center here in Dallas. He plans to train as a cardiologist and has an interest in preventative cardiology, working with underserved populations and mentoring Black youth. During the COVID pandemic, he has become an advocate for the COVID-19 vaccine, using his voice and his social media platform to advocate for vaccination, which he believes is one of the most important components to helping us get back to the things we know and love. And last, I would like to welcome our panel moderator, Pastor Patrick E. Winfield II. He campus pastor of the Potter's House of Fort Worth, an educator and a leader within and outside of his community. With an extensive educational background, Pastor Winfield is presently pursuing a doctorate education from Dallas Baptist University. He accepted the call to preach in 1991 and was ordained in 1996. And he stands on the scripture, Joshua 1:8, which says, "This book of the law shall not depart out of thy mouth, but thou shalt meditate therein day and night, that thou mayest observe to do according to all that is written therein, for then thou shalt make thy way prosperous, and then thou shalt have success." Pastor Winfield's greatest inspiration is his wife and their 3 sons. I want to welcome all of our panelists today. They all have amazing, extensive backgrounds. I'm going to link access to their full background in the chat box, so that way you may read more about all of these phenomenal speakers. And until then, I will pass it on to Pastor Winfield, who's going to start off for the evening.
Thank you very much. I appreciate it, and thank you to you, Dr. Asula, for the opportunity to moderate such an august panel. Now, I want everybody to do me a favor, because the information I believe is going to be shared is going to be powerful and yet informative. I want you to do me a favor and get on your social media platforms and share. Let somebody know that we are on and we're having this conversation, because I guarantee you that whatever myth is percolating throughout our community, we can debunk it tonight just with one conversation. And you don't have to fight around the dinner table anymore. We'll do that for you by giving you that kind of information through all of these medical professionals and health professionals, all right? So do that, share, and share some more, all right? So let's dive right in. Dr. Estelle, with all of the things that's happening within our community concerning COVID-19, there's been a whole host of issues and myths and ideologies and conspiracy theories that has come out of either people watching too much social media or YouTube or whatever. Within the context of your profession, what are the currently approved vaccines for COVID-19, and what is the dosing schedule for these vaccines? And how long does it take for you to be fully vaccinated?
Right now in the United States, there are 3 approved COVID-19 vaccines. And the 3 of them use 2 different mechanisms to help our immune systems learn how to identify this virus, SARS-CoV-2, which is responsible for COVID-19 infection, and to attack it so that it doesn't cause illness in your body, or if it does cause illness, that illness would be much less. And so those 3 vaccines are the Moderna vaccine manufacturer. Pfizer's one of the manufacturers, and both of those are a messenger RNA technique to cause that immunity. And then the other is the J&J vaccine, and that uses a adenovirus vector technique to cause your immune response. And so the three are, in terms of their efficacy or effectiveness at preventing infection that would lead to hospitalization or death, they are all three very, very, very effective at that, which is really important. The main differences between them are the techniques that they use, and then how they have to be stored, and their dosing schedules. So for the Moderna and the Pfizer manufactured vaccines, those are both messenger RNA, and both of those require 2 doses. And for Pfizer, you get your second dose after 21 days from the first dose. And for Moderna, it's after 28 days after the first dose. The J&J has the benefit of only requiring 1 dose. So those are the big difference. And then the other really big difference is that both the Pfizer and Moderna vaccine methods, they have a lot of logistical requirements in terms of temperature and how long you can have them out before they must be thrown away. And those severe restrictions are not present for the J&J vaccine. In terms of how long does it take your immune system to mount that response, to learn to do what the vaccine is training it to do, it takes about 2 weeks after the final dose. And so that's 2 weeks after the second dose of the messenger RNA technique vaccines, or 2 weeks after your single dose vaccine.
So, Dr. Wallace, chime in on this one.
You're muted.
I'm muted.
Still muted?
Am I still muted?
Sounds like you
Can't hear us?
How's that?
Can you hear me? Can you hear me? Okay,
Great.
great. So, Dr. Wallace, please chime in on this one. Many people have asked if the vaccines are effective. And with the situation that happened with the person for the Johnson & Johnson vaccination, of course, that set aflame a lot of thoughts and ideologies concerning the reasons why people should not get the vaccines. So, do they work, and is one better than the other?
Thank you for that question. All of the vaccines work very well to prevent people from getting seriously sick, being hospitalized, and dying. And so I don't know that one works better than the other. I think there are considerations regarding anaphylaxis or severe allergies in terms of which one you might consider taking, as well as whether or not you are a person who can tolerate having 2 injections versus just the one. So I think part of the question is, or part of my response to that is, do you have severe allergies? Do you have a history of allergies? So that's sort of part 1. And part 2 is, do you have a preference, in terms of whether you're going to get the 2 dose or the 1 dose? And, as I've said in many spaces, even before the pause, that people often may not have a choice in which vaccine that they're eligible to get. It's going to be based on the supply, right, and what's available at the vaccination that they go to. But they all work really well. They all basically do the same thing in terms of the ultimate goal, which is to teach our immune systems to better fight off the virus and reduce the impact to our bodies.
So, and this is for you both, Dr. Wallace and Dr. Estelle. Within our community, we all know that doctors do play a very important role, but everybody does not have the same relationship with their doctors. And so oftentimes, talking about vaccinations and things of that nature and getting them, people have the tendency to just kind of go based off of pop culture wisdom and sign up for them and register for them without having an adequate conversation with their personal or private physician and or doctor, and many of them may not have a private physician and or doctor. So can you speak to those people and to those families that would like to get the vaccinations, however, they are somewhat leery as to the impact that it's going to have on their bodies, and what should I do if I don't have that kind of relationship with a personal physician or with my private physician?
So I think what you're asking is sort of what kind of conversation should patients look to have with their doctors about the vaccine? Um, did I hear that correctly?
Yes. What
Okay.
kind of conversations should they have with their doctors about the vaccines? And if I don't have a personal physician, who should I talk to? Where do I go to get some help
Ah,
in making this decision?
absolutely. So first thing, I'll start off with what are good sources of
Mhm.
information? What are good places to go to get information about vaccines and COVID? Is really the CDC's website. So cdc.org. It has a ton of information. There's entire pages that are dedicated to answering questions, very specific questions about each of the three vaccines that are currently available in the US, different side effects, and then common questions that people have. So if you don't have a physician or provider, an NP or anything like that around you, that is a really good reliable place to go.
Okay.
So that's that. So then if you do have a provider and you're wanting to approach this discussion with them, and what kind of questions would you want to ask is things like, am I the right person for this vaccine? Is there any reason that I should not get this vaccine? And what they're likely going to talk to you about is they're likely going to say, ask you, if they don't already know, if you have any allergies to any particular medicines or vaccines, or particular products that may be in the vaccine. There's actually a very short ingredient list for each of these vaccines that they will look up and look at and make sure that you're not allergic to. They'll potentially ask you, things like if you've ever had an allergic reaction to a bowel prep, things like that, that would have common ingredients that are in these vaccines. And if you have, then they would entertain a discussion with you about what that reaction was and if it was anaphylaxis. And anaphylaxis is our medical term for a very severe allergic reaction that needs an EpiPen or to go to the hospital for. And then that would sort of guide that conversation. There are not any medications that prevent you from being able to get the vaccine. Say if you're on anticoagulants or blood thinners, you can still get the vaccine. That's not a reason to not be able to get it, and things like that. So if you have allergies to other foods or things like that, what they may say is, hey, when you go get this vaccine, let them know, and they will monitor you for an additional few minutes after you get the vaccine to make sure that it goes well. Right now, as Dr. Wallace alluded to, people don't get to choose which vaccine they get. It's really whatever vaccine is at the site that you are going to. So you can try to call ahead to that location and find out which one they are offering, and potentially sort of get some information that way. But it's unlikely that any of those sites would be able to accommodate giving you a different one if you asked for it at that time.
Gotcha. So,
And thank
go
you,
ahead. Go ahead,
Pastor
Dr.
Winfield.
Wallace.
If I can offer one other resource that's commonly available to maybe our audience, community pharmacies or your local pharmacist is another access or resource to be able to have the same conversation that Dr. Estelle mentioned. In Texas, roughly 90% of our population live within 2 to 3 miles of a community pharmacy, and many of them are offering no appointments or call or not only information for you to be able to make that decision for you and your loved ones, but also being an appointment to have your vaccine delivered as well. In the state of Texas, licensed pharmacists have been providing immunizations for over 10 years now. We offer a whole slew of information, but other types of vaccines as well.
Thank you, Mr. Manuel. I really do appreciate
The
that.
other things that you
Go ahead.
may have this discussion with your pharmacist and your physician is going to be, what are the side effects? What should I expect from this?
Yes, sure.
You should expect to have some side effects, quite honestly. And they're going to include things like just feeling really crummy, muscle aches and pains. A lot of people, most people actually will get some pain in the arm where you get the injection, feeling very tired, potentially getting a fever. Sometimes people are getting some nausea. And so those are decently common side effects that you should honestly just expect to have. And if you don't, then yay. If you don't get those symptoms, it doesn't mean that something bad is happening. Really, when you experience those symptoms, it's as a result of your immune system starting to activate. And so it sort of represents it starting to do what it's supposed to do. But again, just because you don't have those symptoms doesn't mean that your immune system is not doing what it's supposed to do.
Now, you just highlighted something for us that I think is very important for us to recognize and to underscore, and that is the conversation that you're having both with the physician and with your local pharmacist. I know this is a little bit off track, but Mr. Emmanuel, can you talk a little bit more about that and how the local pharmacist can help people to make decisions concerning the vaccination and concerning whether or not they should take it?
Definitely. So part of your question was about if an individual does not have access to their primary care physician, or they may not have a continual relationship with a provider that they can ask this question. Most people, probably all Texans, have been in a community pharmacy, and when I say community pharmacy, which I want to set the frame, I'm talking about not only your corner drug stores, your independent pharmacy, but also your grocery stores are now available resources those same conversations with. Most pharmacists or doctor have their doctorates in pharmacy. And again, we've been immunizing patients for over 10 years for something as simple as a yearly flu shot to some of the other ones as well. So having that conversation with your community pharmacy that you can walk into and have a conversation with them is a key resource for many people in our community. Like I mentioned, 90% of all Texans within 2 to 3 miles of the pharmacy they have access to.
Wow. So let's turn the corner a little bit. I want to come back to that in just a moment, because I think one of the things that happens within our community is we like to self-diagnose. So we go to barbershops with self-proclaimed pharmacists and doctors. We go to family reunions and sit around Big Mama's table, and everybody has got a prescription for something, and that may not all the time be helpful for us, especially when we're trying to get information that's going to help us to make better decisions concerning this vaccination piece. So Dr. Capers, I want to pitch to you a little bit and ask you, do you think that the vaccination is particularly important in the Black and brown communities, and why? From your perspective, why?
Well, thank you for that question. Yes, it is critically important. We have the highest, and when I'm talking about Black and Hispanic communities, have the highest rate of being hospitalized if they catch COVID, the highest rate of death if they catch COVID. And so it's really doubly tragic that those communities also right now are the communities that have the most hesitancy to get the vaccine. Because of structural determinants of health and structural racism, the way we live, multi-generational housing, poor housing, the fact that we can't take off work, the fact that we have, as you pointed out, less access to good health care, our communities really are having the worst outcomes. And because of Black and brown people tend to have higher rates of things like high blood pressure, kidney disease, diabetes, things that can make your outcome worse. So if there is any community that I would hope would be running to get this vaccine, it's the Black and Hispanic communities. So we're at higher risk of dying. And we need to get the vaccine to stop that.
Dr. Capers, your work in the community is lauded and highly respected, not just academically, but certainly bringing up the social consciousness of our people and really helping us to embrace what's happening in our community. Now, oftentimes we don't have the conversation about healthcare and don't have the conversation about how that is a very significant issue in our community. And I do honestly believe that that's one of the reasons why we suffer a lot in our community, because we're not as aware or not as informed. And so now, in your fight to make sure that proper information is disseminated in our community and that we do have access to better health care and things of that nature, what are some of the issues that you have seen within our community that we all need to be aware of, that we all should be like fighting for and fighting against? And how do you see us coming around each other to help and assist in making sure that our community has the proper vaccinations that's needed?
One of the most important things is what we're doing now, just giving out the information. And so I love it when churches, when barbershops, fraternities, sororities host events like this where we can get the information out.
Good.
Black people have a reason to be hesitant when the healthcare sector says, hey, I've got something for you. I've got something for you and it's going to make you better. Because there have been some atrocity tinged by racism, where the healthcare system has really done some horrific things to our people. However, look at all of these people here on this call that are here to help. And most doctors really want to help. So one of the best things we can do is get the information out. Because as you were just saying, when we don't have the right information, when we're talking to our friends, our cousins, I talk to my cousins a lot too. That's good to talk to your cousins. But if I want some information about a certain topic, in addition to talking to my cousin, I'm going to talk to somebody who's a professional in that field. So one of the best things we can do is get the information out. And I love it when we do it at the church. I think every Sunday at the church, we're going to have somebody talking about the COVID-19 vaccine.
Wow, thank you for that. Dr. Pierce, what would you say to someone who is young and healthy and is asking him or herself, do I even need to get vaccinated?
The thing that I'd ask you to think about is, even if you're young and healthy, we have no idea how this virus, COVID-19 virus, will affect you. In the emergency department, I see very young people with no underlying health conditions that come in very, very sick with this virus. And so getting the vaccine can help protect you from severe illness. It can help protect your community from severe illness. Those people who may not be able to get vaccines, babies, can be protected if we get community immunity by you getting vaccinated.
I don't think our younger demographic, well, because when you're younger, you feel like you can do anything and you're pretty much impervious to anything that could hurt you or harm you. And because I do know some young people who 1 year ago didn't believe that COVID-19 was real, and so they went out and they kicked it, and spring break they kicked it and all that stuff, and they brought home COVID-19 to their family and to their loved ones and to their parents who were older and aged, and as a result, parents died just because of the young person's irresponsibility to know or to be informed. Dr. Pierce, how can we help our family members and friends overcome the fear of getting vaccinated, and by the same token, to learn how to take this point in time of our lives, especially being in this pandemic, serious enough to hear professionals talk about vaccinations and its importance? How do we do both and? Because we're fighting here. We're fighting to get the vaccinations, and we're fighting to make sure that demographic takes it serious?
And I really think one of the most important things is to just start the conversation, do things like we're doing today.
Okay.
And anyone who's been vaccinated can share their experience with friends, family. You know, we can discuss any mild side effects we had. I was vaccinated in December and January. You know, I discussed with friends and colleagues what my experience was with the vaccine. I volunteered at multiple vaccine clinics, just talking to patients about their concerns, what they can expect. And I think just having that conversation, learning about what someone is worried about, what they're caring about, can really just help them to be more open about considering vaccination. Discussing, you know, things that I've seen as far as patients coming to the emergency department, young, healthy people who couldn't breathe because of this virus. I don't want to see another Black or brown person have to come into the emergency department and not be able to breathe because of this virus. So I want you to not get this virus and expose someone else to it. You know, you talk about your elderly family members, and I've seen numerous people, you know, and they were going to work for their living because of the things that we've talked about, social determinants of health, the careers being essential workers. And then you bring that virus home to a family member, you know, family member with metastatic cancer who has been fighting metastatic cancer, who doesn't survive because of this virus. So I want you to think about yourself, your family, your community, and how you can make a difference by getting the vaccine.
And do you mind if I add
No,
just one other component to that? Thank you, Dr. Pierce. I've also found that one of the ways to help combat fear is to show hope. And so the other side of the coin that I like to think about is what are the good things that getting vaccinated can bring back to us? And how can that help us get back to the things that we know and love, the things that we cherish, the family connections that we have, that we've been that we haven't been able to have over this past over a year. And so a lot of times I find that when we think about what are the good things that getting vaccinated can bring us, the security and the kind of peace of mind, and knowing that I can, you know, once we get enough people vaccinated, we can spend time with those people that we love. That to me is comforting, and to a lot of people that I've talked to and have gotten vaccinated, they've found that comforting too. So.
Wow, thank you for that. I think this is being very informative, and certainly to be able to have this panel discussion is certainly it's very positive for us, because we don't get an opportunity to talk about vaccinations, talk about the importance of them, talk about the impact of COVID-19 to our communities with healthcare professionals often, right? So this is great. If you have any questions, and I'm going to ask just a few more questions to our panelists, and then I'm going to open it up for a Q&A. So if you have any questions, we want you to ask those questions so that we can get them answered in this forum. This is a wonderful opportunity for you to engage with healthcare professionals that you probably would not have met if it was not for this particular forum. So once again, Dr. Asula, thank you so much for the opportunity to have this conversation. Dr. Capers, what would you say to people who are waiting longer to see how the vaccines are going to play out before getting it themselves?
I understand the desire to want to wait, but here's what I would like for people to think about. There's something that we know, and we know what happens if we get the infection. We know that there's a good chance that you can get really sick. And when I say really sick, I mean that you can die, or you can pass it on to your family members who can die. And it's almost like taking a chance. You know, when you get in your car, you can put on your seatbelt or not put on your seatbelt. And a lot of times, if you don't put your seatbelt on, everything turns out fine. But there's that chance, though, that you're going to get in an accident and go flying out your front window. So why take the chance? I want you to think about its risk versus benefit. The risk of taking it, which none of us here can tell you the risk is zero, but we can tell you what the risk is of getting COVID. And if you're getting very sick with COVID, we can tell you the benefit that there's a really good chance you're not going to get sick with COVID if you get these vaccines. I would never tell somebody to get it without, talk to your doctor, talk to your pharmacist, get some own personal information. However, we want you to please think about this. And I really love what Dr. Osula just said. The sooner we all get the vaccine, and by the way, I've had it. My mother, who's 75 years old, has had it. My wife, my daughter has had it. The sooner we all get it, the sooner we can get back to normal. So really think about that. We want to protect you, and we want to protect your family.
Dr. Capers, you brought up a good point there, and I really loved your illustration of putting on the seatbelt. But a question that I get so often is, and I'll phrase it like this, I'll say, if you're calling the vaccine a seatbelt, how do I know that this seatbelt is safe? And I'll ask this to anyone in the panel, Dr. Estelle or Dr. Wallace, particularly if you guys have any thoughts. How do I know that the vaccine is safe?
So the primary mechanism that we have to know the vaccine is safe is the clinical trials that have been done to date. There have been, so for each of the vaccines that are approved at this time, they've each gone through very vigorous clinical trials to evaluate exactly for safety. And each of them in those clinical trials, first, they all enrolled more than is typically seen as in clinical trials. They enrolled more participants and volunteers than is usual, and they were able to demonstrate that. Each of these also enrolled more participants of color than pretty much any clinical trial, particularly vaccine clinical trials in history, really. And so we were even part of this analysis to know that. And I think, so and then for the Pfizer and Moderna vaccines, we've administered, we've administered 200 million doses of vaccine in the US total, and only about 5% of them makes up the J&J vaccine. And I bring that up so, we've administered a very large number of these Moderna and Pfizer vaccines, and the surveillance and monitoring, the sort of voluntary surveillance has been more robust for these vaccines than in any other vaccine in the past, using both the VAERS system, which is just a system where physicians and doctors and pharmacists report in any adverse effects that their patients may come in with from a vaccine. And then the VSafe, which is you can voluntarily enroll in to tell directly yourself if you're having any symptoms. And through all of those mechanisms, all of these vaccines have been monitored. And there hasn't been any additional concerning signals with Pfizer or Moderna. What you have heard about in the news probably is that there is now concern about a signal picking up in the J&J vaccine. And so what is important to know is that this is actually exactly what these monitoring systems are designed for. They are designed to detect any kind of signal that might be concerning early and quickly, those sort of rare events that you can't see until huge populations have gotten it. And what it does is, and so what they've done, you've probably heard about, is they've said, hey, let's hold off on getting this J&J vaccine while we collect more information. So this gives the public health arm the time to get all the information out to the physicians and the pharmacists to be actively looking for this, to order different tests and find more cases if there are any, so that we can look at this more closely. And so that's really encouraging, that this system is working, that it's detecting and looking for that. And so it is important regarding this, the events so far that they've identified, there's been 6 of them out of approximately 6 million people overall that have gotten the J&J vaccine. But of note, they have noticed a trend that this has occurred really in women in the sort of 18 to 40 years old. And so of that population group, the rate that thrombosis is happening, or those blood clots are happening after getting this vaccine, is above the expected rate. And so that is why they're looking into this. And so that is what's being evaluated at this time, and more information is being collected, and the like. So for certain, we have no concerns at this time for the messenger RNA vaccines. J&J, by and large, seems to be effective and very safe. And this is a very rare event, but we are looking for more information on it.
Thank you, Dr. Stell. Can I ask one follow-up question? What should people do if, one, they've already had the J&J vaccine, and what should happen if they are planning to have, or were already scheduled for the J&J vaccine, in advance?
Yeah, so if you are scheduled for the J&J vaccine and haven't received it yet, then you should, your provider that was going to administer that, they will be canceling that, and hopefully they will be rescheduling you for a different one or at a different time. So I would follow up with them if they haven't already rescheduled you, to say, hey, I want to make sure that I get rescheduled. Okay, so if you were planned to get one and haven't yet, you're not going to be given it during this time period that it's on a pause. And then for those who have received the J&J vaccine, all of the incidents where this has occurred have occurred within the first 14 days. So if you are beyond the first 2 weeks after having gotten your dose, then you be on the lookout, but it's unlikely that you're going to experience any symptoms or consequences. If you are within 2 weeks, if it's in the first 14 days of getting that vaccine, what we want you to do is to be on the lookout for symptoms like headache or blurred vision, or shortness of breath, any chest pain, potentially swelling in the legs, any kind of weakness anywhere. Or if you start getting little tiny specks of bruising on your skin, if you notice anything like that, give your physician, your provider, your doctor a call. If you don't have a doctor, you can go to an urgent care or an emergency department to get that evaluated, and they will then draw some blood tests to evaluate if that may be what's going on. And again, all of those occurred within the first 2 weeks. The other sort of collateral, or the other additional information that shows that this is really in that timeline, is the AstraZeneca vaccine, which is not approved in the United States, but has a similar mechanism of action. It uses that adenovirus vector technique that the J&J uses, did see this same signal, and in the cases that they saw, they also all occurred within the first 14 days as well.
Okay, so you talked in your explanation about access to the vaccinations, and there are people who may not have proper information as to gaining access to the vaccinations. Typically, we could talk about it here, and there are people that may be more knowledgeable about getting access to the vaccinations than other people. So we want to kind of bring everybody up to snuff, if you will, as to what is out there. So Dr. Thomas and then Mr. Emmanuel, what are the latest initiatives underway to improve vaccination access in the DFW area? And is there anything being done to ensure equity in terms of this access?
So I guess I'll go ahead and start. So when it comes in terms of initiatives of access, we've all seen over the last several months about the hub activity and the mass clinics that have been going on at several of the hospitals. And the counties themselves have been holding mass clinics from several clinics in the county area and then several across Tarrant. Also, Denton County and Collin County have been getting involved in as well. So a lot of initiatives of access has improved significantly, especially since the access of ages. We've moved through the priority categories significantly. So every individual over the age of 18 has access and ability to get the vaccine. The thing that's really expedited access, besides moving through the priority groups, has also been allowing it to be available at the community pharmacies as well. So when you think about equity, access to the vaccine is in your backyard. It's in where you live, and everyone lives here within Texas. So that's been something that really helped drive the numbers, but then also across the country. Mr. Thomas?
I don't know if he was able to pick up.
We have Mr. Thomas, just 1 second to see if we can get him online. Mr. Thomas, are you able to hear us?
Thank you. I was muted. I wasn't able
Okay.
to be taken
There
off
we go.
mute.
Okay.
All right. Good evening. Thank you for having me this afternoon. If you would, let me give a little insight. I don't really think that a lot of people have a knowledge of the important of the role, the critical role that the city council members and the mayor play and have played as relates to COVID-19. One of the responsibilities I have that was not included in my bio is I'm the chair of the ad hoc committee for COVID-19 for the city of Dallas. Myself and our health and healthcare czar for the city of Dallas at the time, Dr. Kelvin Baggett, formed the Black COVID-19 Task Force for Dallas, where we began to work together to provide opportunities for testing sites. See, it's easy to have a revisionist history, but there was a time in Dallas, in other parts of our community in the southern part, where we did not have access to testing, where we had to drive on the other side of town just to be able to get a test. And now tests are available on every corner. We're still dealing with this equity issue and this equity challenge as it relates to access to the vaccines. Even though there was a hub that was set up at Fair Park in South Dallas proper, the individuals who were qualified, who were able to get the vaccine, lived in North Dallas for weeks. We had great challenges with people who lived in Southern Dallas even being able to register, less known scheduled appointments. And so we have to be able to tell the whole picture, not just the pretty parts. We've got to be able to tell the whole picture of how we got to the point to where now we have more vaccines. Now we're starting to see them at our local pharmacists. But there were months when people in Southern Dallas, African American and Latino individuals who did not have access to testing or the vaccine. And so now we have to make sure that we focus on two fronts. One, we have to make sure people have good, accurate information about the vaccines, that they are safe, that they are healthy. And we need Black people. We need people of influence. We need people who have the respect of the community, our clergy, our community leaders, our barbers, our beauticians, those who have the respect in the hood and of the hood, if I could be politically incorrect, have to be the ones who not only are getting the vaccine, publicly showing that they have received the vaccine, but also they have to be the ones that are holding education sessions about why the vaccine is safe in our communities.
Well, thank you for saying that. Let's dive in a little deeper. What do you think then are some of the main issues um, facing us as it pertains to how to impact policy, such as to create these kinds of, or to mitigate these kinds of disparities that we find within our communities? Is it a policy issue? Is it people being more knowledgeable? Is it all of the above? What do we need to do to address it so that we can make sure that our people are well informed and well served?
Well, first and foremost, we have to be aware of the political climate in our state, because the state is where the allocations, the determination of the allocations are being made. We have to be able to be visible and vocal. There is a legislative session that's going on right now. I talk with State Senator Royce West probably every other week. And when we were having challenges of getting testing, less known vaccines, then we were communicating almost on a daily basis. We have got to speak up and speak out, and we've got to make sure those who represent us at the state level are letting the governor know of these challenges that we're facing here in our community. So when we talk about policy, we got to be aware of the fact that the state legislature a few years ago zeroed out in the balance the Office of Minority Health. We do not have accurate data to this day in the state of Texas in terms of the percentage of individuals who are testing positive for COVID-19, the ones who are getting access to the vaccine for COVID-19. These things must be made a priority, and we have to speak up and we have to speak out. And we cannot allow these things to continue, because business as usual have never benefited people of color in the state of Texas or in this country.
Point well taken. Dr. Pierce, how do you register to get vaccinated in Dallas and in Fort Worth?
Okay. Ms. Hanson, if you would show that slide for us, please. So on the screen, we have links for registration in Dallas and then in Fort Worth. So in Dallas, you can register at the link above with the Dallas County Health and Human Services. There is online registration. And when you go to the green link and click on that link, it will give you an option currently to get your vaccine at Fair Park or get your vaccine at the Potter's House. In Dallas, you can also register by phone at 1-855-466-8639. The hours for that phone registration are 7 a.m. to 7 p.m., 7 days a week. There will be call takers available to register people in English and Spanish. In Fort Worth, you can register at the link that's showing above, and you sign up on the Tarrant County COVID-19 shot sign up site. And if you're having any questions on the Fort Worth side, there's a COVID-19 hotline at 817-248-6299. In Fort Worth, each person who wants to get vaccinated must complete the sign up process using their own email address. If you only have one email address for the family, you'll need to create additional emails for each person.
Great. Thank you very much. And if we could also post those links in the chat for people to see, that would be great. So Marissa and Aziz, if you could help us with that, that would be excellent. Pastor Winfield, oh, go ahead.
This is
Go ahead.
Carolee. I just want to chime in. One other resource that came available a few weeks ago is that Parkland is now doing a so-called walk-up vaccine clinic. It's not a walk-up, it's a drive-through, but at Ellis Davis Field House. This is in Dallas, but every Monday through Saturday from 11 a.m. to 4 p.m., anyone can come to that drive-through with no appointment and get vaccinated at that time. time. So again, that's Ellis Davis Fieldhouse. I believe the address is 9191 Polk Street, South Polk Street. And that's 11 a.m. to 4 p.m. Monday through Saturdays. No appointment needed for vaccine drive-through.
And I guess I'll also add that on that Dallas County page, there's also a tab that will say, where else can I receive COVID-19 vaccines? And you will be able to see the full list of COVID-19 vaccines that are available. On that link, you will see the Southwestern vaccination sites, and there are 4 vaccination sites that you'll see listed there for UT Southwestern.
Thank you. Thank you very much for that, Dr. Pierce, and thank you, Dr. Estelle, for helping to remember about that awesome opportunity to walk in and get vaccinated. Let's get to some more of the audience's questions, if you all don't mind. The first one that I see, and I want to make sure that we address is, and this is for any of our panelists, if we have pre-existing conditions, should we take the vaccine?
Yes, so it's particularly important actually for people who have medical conditions such as diabetes, obesity, heart disease, these, and asthma, COPD, these actually put you at increased risk of having a more severe form of the infection. And so we definitely want those individuals to get vaccinated. It is important to know that if you have a condition that makes your immune system work less well, if you're immunocompromised is the term we used, it's likely the vaccine won't be as effective. You may not mount as strong of an immune response as those whose immune systems are normal, but it's still worth it to get that vaccine and to do it. And there is no action, the virus is not in the vaccine itself. And so even if you are immunocompromised or have an immune system that doesn't work well, you can still get this vaccine safely.
Thank you, Dr. Estelle. And there's one aspect of that question that I think helps answer another of our questions, which is, can you explain how the mRNA and how the mRNA is the most common part that we hear about. How does that relate to the vaccine? What does that have to do with the vaccine?
And when you're explaining it, because you have people who are watching it that they don't know mRNA and all that stuff. So when you're explaining it, can you explain how, along with what Dr. Asulo said, how that relates to my decision in getting the vaccination? Why is that important, and why should I at least know about that concerning the vaccination?
Yeah, so the messenger RNA technique that everyone's talking about is, it's a newer technique. They have been studying this technique though for more than a decade. So it's not explicitly new, but it's newer. And what it is again, it goes back to what all vaccines do. All vaccines are training your body's cells, the immune cells, which are your immune system, is how your body fights off different infections. And there's lots and lots of cells that are responsible for doing that. And vaccines, they basically show a picture of the virus or the infection that you want your body to know, to be able to identify. It shows it a picture so that it knows what it looks like, and if it ever enters the body, it can attack it and make sure that infection doesn't set up. And so that is all that any vaccine is doing. And the differences between each of the different vaccines is the way that it shows our body that picture of the virus. And so the more traditional way that that's done is they will administer a dead virus or an inactivated virus, or recombinant forms of the virus, so that your body will see that whole thing. What's really slick about the messenger RNA is we have the entire genetic code of this virus. And so what they've done is they've taken a piece of that genetic code that codes for just one little part of the vaccine that we call the spike protein. So not the whole virus, just this little tiny part that's super important. And they put that code in some fat cells, basically, and that is what the vaccine is. And they inject those fat cells that hold this code, and then your body learns that code essentially from the vaccine and is able to recognize and identify it. The J&J does this by using an adenovirus vector to deliver that little snippet or part of a code, and it's delivered that way. So that's sort of how they work, and that's important to know because you cannot get COVID infection from these vaccines because there isn't a whole virus in it. And so it can't do that. Additionally, some people have been concerned about, can that genetic code affect my genetic code when it gets in there? And it does not go into the part of our cells where our genes are regulated, where our genetic code is regulated. So it does not, and it cannot affect our own DNA and our own genetic code. I think that's the question you asked, and if it's not, let me know.
No, that was good and quite sufficient. So I got the Moderna vaccination. My wife got the Moderna vaccination. There are other people that got the Pfizer vaccination, and some had some side effects to it. I had none. I talked to people on both sides. Some had some had none. What are the factors that will determine whether or not somebody has a particular side effect to either of the vaccinations? Or are there?
Everybody's body is different, and everybody's going to react different. I think that holds true to any medicine, and I think it's definitely still true here. Many people will get the side effects, and it just sort of represents your immune system boosting up, but some people won't, and it doesn't mean that the vaccine's not working or that something's wrong with your immune system.
Great.
This question is for anyone. What do we know at this point about how long the vaccine's effect will work? Is this something that will be required every year, like the flu shot?
So that's a really, really good question. What we know about the COVID virus itself is that, and again, we're learning all of this as time goes by. As more time passes, we'll be able to give you more information about how long things work. But to date, what studies have demonstrated that natural immunity, or the immunity you get from having the infection itself, lasts about 8 months. It's probably going to be longer than that, but studies so far have demonstrated about 8 months. And we know that when you get the immunity that you get from a vaccine is actually stronger and lasts longer and more reliable, or more consistently develops with the immunity through a vaccine compared to the immunity you get from getting a natural infection. So at a minimum, we anticipate probably to get at least 8 months of immunity from these vaccines, likely going to be longer than that. But at this time, we don't actually have a full answer to that. And the question of, are we going to get, yearly vaccines for this like we do with the flu? My typical response to this is, let's just get everybody vaccinated the first time, and then we'll cross that bridge.
Thank you, Dr. Estelle. We have this question from someone on Facebook. People who have had Guillain-Barré syndrome are not recommended to take the flu shot or the tetanus shot. Do we know if this also includes the COVID-19 vaccine?
Yeah, at this time, it is not, having a history of Guillain-Barré is not an exclusion for getting the COVID vaccine. It has not been associated with that condition.
So you can still get the vaccine with Guillain-Barré syndrome. Okay. Okay. All right.
There's another question that came in, and this is for anybody, of course. I have underlying conditions. I thought I would be a priority, but it took a long time to get my first shot, and my second appointment has been delayed. It's more of a statement. So I guess the question would be, what should this person do?
I'm going to repeat the question to make sure I got it. You said they got the first dose, they got COVID, and they're waiting for the second dose. Is that correct?
So go ahead.
I actually think this person, so they didn't get COVID.
They didn't get COVID.
It took a long time to get the first shot, and they're wondering what should they do. Their second appointment has been delayed now. What should that person do?
In the meantime.
Yes. So if there's a delay in getting your second dose, the answer is to just still get that dose as quickly as you can. And they're not going to make you start the series over again. You'll still just be able to get that second dose. The plan is that it should be given within 3 to 4 days of the 21-day or the 28-day schedule. And if you can't do that, to get it then within 42 days. But if you can't do that, just get that second dose whenever it is that you can get it.
But in the meantime, what do I supposed to do if I have some of the underlying conditions? Is there anything that I can do to help with those particular conditions while I'm waiting to get that dose?
Yeah, so you should continue to use good hand hygiene, mask, and physically distance, especially when you're around other people. So you should continue to use all of the public health interventions to help protect yourself and others while you're waiting for that second dose. Additionally, actually, in reality, once you've gotten the second dose and you're 2 weeks after, you should continue to mask and distance and wash your hands when you're in public or around other people who are either haven't been vaccinated or haven't finished their vaccine series. But if you are just in a room with people who are all 2 weeks after the full vaccine series, then you can take off your masks and give each other hugs and do what we like to do.
And I want to emphasize something Dr. Estelle said there, and that was that that's once everyone there has been vaccinated. Is that correct, Dr. Estelle? Right.
Yes, once everybody in the room has been fully vaccinated, if the 2-dose regimen and it's 2 weeks after you've finished being vaccinated, if everybody present.
Exactly. This question as well for anyone. What should I do if I've had COVID or COVID pneumonia and I am in the middle of my COVID shots? So let's say I've had my first dose and then I still get COVID. What should I do about my second dose if I'm taking one of the 2-dose shots?
Yes, so you can just wait so if you got your first shot and then you ended up getting COVID, you're going to have symptoms from COVID. Once all those symptoms are gone from having that COVID infection, then you can get your second dose of vaccine. Now, if you had gotten treated for the COVID with one of our special treatments called convalescent plasma or monoclonal antibody, if you got any of those special COVID treatments when you had COVID, then you'll have to wait 90 days before you get the vaccine after those treatments were finished. But if you didn't have to get any of those special treatments and you had either severe COVID or mild COVID, once your symptoms are resolved, you can go get, and you're no longer infectious, then you can go get vaccinated.
While we're there, Dr. Estelle, what about variants? Are vaccines still going to protect us with all of the variants that have come out?
Yes, it's a great question. So first, what are variants? So variants are viruses, they multiply and replicate themselves really, really quickly. And sometimes they make mistakes when they're replicating. And those mistakes occasionally will lead to a change in the way that that virus behaves. And so sometimes it will make that virus spread more easily or cause more death, or potentially get around the treatments and vaccines that we have. And so right now, so the variants that we talk about are there's thousands of variants, all right, but the ones that we talk about are the ones that sort of are important because they either spread more quickly or they're causing more death or they're getting around vaccines and treatments. And so far, the variants that are of concern right now, the UK, Brazil, South African variants that are around, they spread about 40 to 70% more efficiently. So they spread much, much more easily from person to person than the other what we call the wild type spreading around. Right now, the vaccines that we have that are approved in the United States are all still highly effective against the variants that are circulating in the United States. And so that is very good news. There is some concern about a little bit decreased efficacy with one or two of the variants, but those two variants are not circulating at high level in the US yet, or at this time.
Great. Thank you, Dr. Stell. You mentioned the vaccines that can be used here. Are the vaccines FDA approved, or what is the actual status of the vaccines?
Yeah, so the 3 vaccines in the United States right now are approved by the FDA through emergency use authorization. And that is it's a special kind of authorization that gets used in emergencies like a pandemic. And what it really means is that they did all of the clinical trials. All of that went through every single step that's normal and appropriate and necessary. And the FDA still does all of the things that they normally do in terms of reviewing that data and all of the steps that have to go through. They just did them all immediately, if that makes sense. So normally there's a whole bunch of, stoplights of wait in line here, wait another year here, wait another year here before somebody or the FDA or these different groups will review that data. A lot of this skips through that. It also means that they were able to use just those clinical trials as they are for each of the vaccines.
So what are the chances after I get the vaccination, what are the chances of me getting COVID-19? And if I am walking around asymptomatic, what are the chances of me passing it on to someone else?
Yeah, so that is a difficult one to answer. The reality is we don't fully know the answer to that question. So the clinical trials weren't set up to answer that question, so we don't know, but there have been more sort of studies to try to look at that from a different angle that are suggesting that even spreading infection when you don't have symptoms is decreased if you've been vaccinated. So that's really good because at first we didn't know at all. But in terms of being able to give, what's the likelihood and sort of numerical information, we don't have specific clinical trials set up to evaluate that. We don't have specific data to give, but we know, but that's part of the reason that we still want people to wear masks is after they've been vaccinated, because we don't really know yet at what level people who have been vaccinated and get exposed to COVID, at what level are they potentially getting some of this virus that's just not making them sick, which is the plan of the virus, of the vaccine, but are they still able to spread it? So we don't really know that answer. And that's part of why it's so important to continue masking, washing your hands, and physically distancing even after you've been vaccinated when you're around other people who have not been vaccinated fully.
I'm so glad that you said that. And Dr. Asula, the reason why I asked that question is because, um, either working out at the gym or, last night we went to the baseball game, and it's very interesting to see how people are responding and reacting to the fact that they got the vaccination, and still not wearing masks in public. And certainly that is a concern because we want to make sure that we are keeping everyone safe. But if it is not, if no one informs us of how to respond after vaccination, post-vaccination, what are some of the things that we should be looking out for? What are some of the things that we should continue to do, even though we are vaccinated? Then we build up this mindset or this myth that we are impervious and we are not able to impact somebody else. And so I wanted to really address that because that's a significant issue in our community too.
Yeah, thank you, Pastor Winfield. Do you guys have any thoughts on what should life post-vaccination right now look like?
Well, if I could just make one comment and kind of reiterating something that Dr. Estelle mentioned earlier in the session, the vaccines are effective, 90% or 95% effective when individuals take the vaccine, especially the Moderna or the Pfizer, once they've completed the entire schedule. What's not quite known right now is transmission. But I want to comment on that there is mixed messaging that's out there in our state. Mr. Thomas mentioned about the political climate, and I think that it makes it very confusing for people, just everyone, is the idea that the restrictions have been relaxed from a state mandate perspective. We have organizations and retailers and stores that are maybe not requiring the same level of social distancing or mask requirements. And what we need to think about is if you are not vaccinated, we don't know if in fact you are transmissible, but like you mentioned, Pastor Wynn, the idea of children's sports are open up right now. The state and cities are looking a lot more like normal. Infections are still widespread. Cases are still in some instances at the 7 averages are in fact ticking up. So in both Dallas and Tarrant County right now, we're about a 26 to 27% vaccination for both of those counties. It's still a risk for us to kind of get back to doing that we would think about we're doing more than a year ago. So I think about what would it look like after vaccinations. Number one, you would still be doing social distancing. You would still be wearing masks. But then the other challenge, we don't know what individuals around us, their vaccination statuses as well. So when you're walking groups or larger, you heard Dr. mention in households that are fully vaccinated, be a little more relaxed with it, but all of that information, recommendations are on the CDC website. But the challenge we face is what it looks like when you're out in the public when we don't know pure vaccination status and rates that are out there.
Thank you.
Still need to be highly cautious as the state continues to open up.
Thank you. So it sounds like in summary, when you're in your own household that's fully vaccinated, you can relax those restrictions. But for right now, while we're out in public, we still want to be wearing masks. We still want to be taking those precautions because we're not quite at the level of vaccinations that we need to be at yet to really relax those things. That's what it sounds like. We've got time for maybe one or two more questions. There is one question that I want to make sure that we get answered tonight, and that is, what should I do if I'm trying to decide which vaccine to get? Should I wait to get the vaccine that I want, or should I take any vaccine that is available to me?
I would take the first vaccine that becomes available to you. You can, it's up to you. It's always your choice, but it's important to remember that while waiting for the because we're still waiting for these ramp ups and getting more access and the the logistical difficulties of getting, certain vaccines to certain people, and now even with the pause of J&J, the time it's going to take to be able to request which vaccine you want is not in the near future. And so waiting for the vaccine puts you at risk for potentially for the vaccine modality that you want, the particular brand that you want. You may get COVID while waiting for that vaccine brand that you want. And if you get the COVID and you happen to get mild disease, great. Then you weren't harmed by it. But were your family members harmed by it in that time period? Or now the data is coming out that people are having, even people who had mild disease, who had hardly any symptoms, are having, problems for months and months and months later, even though they didn't have severe disease. Will you possibly be that person? So right now we advise that you take whichever one comes to you first, and then down the line we can when supplies are more available, if we start having to do this on a yearly or biannual basis, then you can start waiting for a particular brand.
Thank you, Dr. Estelle. Unfortunately, we didn't get a chance to get to all the questions. There's so many great questions that we had. Pastor Winfield, are there any burning questions that you just have to get answered right now?
I think all of my questions that were burning were absolutely answered. I want to say thank you to all of you for participating in this particular forum. One of the things that I find is important for me as a leader is to make sure that we are creating platforms where people can receive this information and get it disseminated in such a way that it is both articulate and intelligent and useful and practical. And so thank you so much for doing that. That's my thank you. I want to say this to everybody and then turn it back over to you, Dr. Ursula. Knowledge is not power. Knowledge is potential power. Knowledge applied is power. So this information that you have received, you've been watching this, to apply it is to get vaccinated, is to get as much information as possible about the vaccinations so that you can make an adequate decision for you, for your life, and for your family. I want you to make sure that you consider that the time that you spent hearing this is time well spent. The time that our panelists has spent studying this and practicing this is time well spent and disseminated to you. Now, what are you going to do with the knowledge that you have been given? Empower yourself the way that they have given you knowledge to do so. Thank you, Dr. Ursula, for this opportunity to moderate this August panel. I'm very honored to do so. Thank you, sir.
Of course. And thank you for having me. And thank you for those words. That's very compelling, and it gives me something to think about when I go home tonight. And thank you to all of our guests, to all of our panelists for being here. My final thoughts are that I think we've had so many good things that have been said here, so many snippets. And the things that I'm just in summarizing to myself, takeaways, is that, I think we all have questions and we all have concerns, and rightfully so. But I think that I feel confident that I've learned that the vaccines are safe, and I think that they are effective. And I think that I want you all to just kind of think about that when you go home, and kind of dwell, and then help. I hope that helps you to inform you a little better. And after you've had some time to think about it, go and talk to your doctor, go and talk to your pharmacist, go and talk to the professionals that you have access to, and ask those specific questions that maybe we didn't have time to get to today, but that I think can help you kind of understand better what is the right decision for you. For those of you who have made the decision that maybe you want to get vaccinated now, I would encourage you to go to one of the links that we have posted. And if you guys could post that in the chat one more time, that would be excellent. And for those of you who are still thinking about it, just give it some thought and talk to some more people. And I hope that what we've said has helped to at least help you be a little more informed. I want to thank all of our panelists for being here. I want to thank Potter's House of Fort Worth for having me. I want to thank you personally, Pastor Winfield. I want to thank UT Southwestern for supporting us in this. I want to thank everyone who came, and I hope that you got something good out of it.
Thank you, guys.
Yes. Hey, Dr. Wallace,